take you through a couple of things you can do if you're experiencing regular knee discomfort. Okay, now if you've got something structurally going on within your knee, this is different. So if you've got a cartilage or a ligament-based problem, then this is different. This is more functional stuff, which means that the muscles that are acting on the knee are out of balance, and therefore the knee's a little bit angry. Now that will often present as pain sort of underneath the kneecap or around the kneecap, or kind of a catching sensation that you might get from time to time, or sort of a dull ache either side. If you're getting a catching on the inside or outside, that is more likely to be something sort of articular or to do with the joint. But a lot of knee stuff is preventable, or certainly preventable from getting worse. So we're going to take you through 3 things today that you can do. It'll take you about 5 minutes. So the first one we do is a little bit of a mobilisation drill. One thing we want the knee to do is we want it to basically go in a straight line. So knees that do on these different angles will get angry pretty quickly, because the knee is designed to go straight, it likes to bend like so. What it doesn't like to do is get forced into these sort of angles. So if we see a situation where the lower leg is wound out or rotated out, as a result of that, the knee is then going to track inwards, and over time that's going to get develop an imbalance on the muscles acting on the knee, and also make the knee a little bit angry, end up with some pain. So what we're going to get you doing is holding onto your lower leg, and all I'm going to take that lower leg gently and internally rotate it or twist it inwards. And as I do that, I'm going to bring my knee just towards my toe. Okay, now you can decide how far forward is good for you. We certainly don't want any pain. You want to make sure your knee lines directly over your toe as you come forward. So I'm twisting the lower leg in, and as I do so, I'm letting my knee track and head towards my toe. And go as far in as I want. Not aggressive, it's about a 2 out of 10 in terms of that rotation. Just lightly twisting that lower leg in. Okay, what we're getting that to do is line up better, so that the bones that sit from the lower leg and the upper leg, they start to sit in a better direction and start to twine themselves better. That's the first thing. I get you doing that 10 times. The second thing you can do is use a foam roller or some form of release mechanism and look at the tension on the inside and outside of the knee. So the muscles in the upper leg that act on the knee, we need them to be in balance. If you're tight on one side or more tight on one side than the other, we're going to have a bit of a challenge later on at some stage where that begins to influence the alignment of the knee. So we use the foam roller. We look at using the outside component of the quadricep, which is the muscle above the leg, and the upper leg. And we just roll, not completely on the side. I want you to turn sort of slightly face down, so sort of on a 45-degree angle. And I want you rolling through that. Now, a word of warning, that could be reasonably uncomfortable if you've got a lot of tension on there, and you may want to start that up against the wall where you're in more control of the tension. My body weight effectively creates the tension. The sequence we're going to use is you're going to roll through 4 times, hold on the spot that gives you the best feedback, which is theoretically the most painful part, and then we're going to shift from side to side. Now that's the outside, and we don't want to be right on the outside, we're just on the inside, so we're actually targeting the muscle, not the tendon. Okay, the inside's a little bit different. Again, we face down, but this time we kind of make sure that the roller itself sits in the muscles just on the inside of the knee. Okay, and we can again roll through there. 4 times, look for the spot that gives you the most feedback, hold, and then shift. And this shift's kind of like a sliding motion side to side. Always done nice and slow, and we're trying to work through the point where the knee muscles feel happy. Now, the likelihood is that one side is going to be more interesting than the other side. You don't have to do both sides to the same degree. If you find that consistently the outside, for example, is worse, that's the side I want you to target. Okay, we don't want to go freeing up the inside when the inside's actually tight in the first place. Third and final thing we're going to do is a little bit of strengthening. We want to strengthen the muscles around your side of your pelvis, your glutes, and in particular your glute med. The glute med is a muscle that sits up on the side of your bum here, and its job is to control the knee in this situation. So when we walk forward, we want to make sure the knee lands and lines up, it doesn't lose control. But that's motion's driven from your hip. The knee doesn't go sideways on its own. Okay, the hip and ankle are the areas that move sideways, so we're going to try and strengthen the hip muscles a little bit. This one's best done up against the wall. So if you want to imagine I've got an imaginary wall behind me, what I'm doing here is 2 different levels of intensity. The first one, I'm just going to lie my hip on the ground. I'm going to lift my leg up, making sure my foot is behind my hip. So I'm taking my foot back, and if I had a wall there, I'd be pushing my foot against the wall, and I'm popping my thumb on the muscle we're trying to target, and I'm just lifting it up and down. As I'm doing that, I'm trying to make sure my pelvis doesn't lift up. So that's me lifting my pelvis up. Okay, that's me keeping my pelvis still. I'm just going to go up and down using that muscle. Now, look, if you could build towards 15 reps, that'd be great, but do what feels good for a start. If you're working down the side of your leg, inside leg, or hamstring, back leg, those are all signs this muscle's not doing the work. So make sure the glute muscle, okay, side of top corner of your glute, we'll say, and I'll send an image through on this as well, is the area of potential. Right, now the second level of intensity here, if you get really good at that one, is just to elevate yourself a little bit. Same idea, leg goes up, goes back against the wall, and we're just driving up and down. Right, this time we're bringing in the core on the opposite side, all right, to help provide that sort of cross-body stability. All right, great if you're a runner or if you're having problems with knee strength. Awesome work. Get involved in those. They could become a great routine day or every second day. What we should find is we get you stronger and release the tension on the quads, or even the tension on the quads up. We should start to see that makes a difference to the level of comfort within your knee. If you want more information on this sort of stuff, either myself or Jane up here in the gym, drop us an email or give us a call. We can sort of maybe tailor something a bit more specific